Identification of key structures. I then introduce the probe in the sagittal plane and keep the probe pointing downwards and posteriorly. I then position the probe in the mid-vaginal cavity. Image the uterus in the sagittal plane. I now demonstrate a sagittal view of the uterus in its midline in the centre of the field of view so that the cervix, vaginal canal, endometrium, and bladder can also be seen. If necessary, I adjust the depth of field, then the zoom, to ensure that the uterus is centralised and occupies between 40 and 60% of the field of view. I then optimise the gain to achieve an even image throughout the depth. I then freeze the ultrasound image. I capture an image and keep the ultrasound image frozen. Label the bladder. I now label the bladder. And I keep the ultrasound image frozen. Label the uterine fundus. I now label the uterine fundus. I keep the ultrasound image frozen. Label the uterine body. I will now label the uterine body. I keep the ultrasound image frozen. Label the cervix. I will now label the cervix. I keep the ultrasound image frozen. Label the vaginal canal. I will now label the vaginal canal. I unfreeze the ultrasound image. Locate and label the pouch of Douglas. Remaining in the sagittal plane, I locate the pouch of Douglas. If necessary, I will adjust the depth of field and then the zoom to ensure that the pouch of Douglas is centralised and occupies between 10 and 25% of the field of view. If necessary, I optimise the gain to achieve an even image throughout the depth. I then freeze the ultrasound image and label the pouch of Douglas. I unfreeze the ultrasound image. To complete the scan, I withdraw the probe, taking care not to exert too much pressure on the patient,